Hein, welcome to the Innovator Circle. You brought some cases for us this year on your use of SAA in post-operative management. Can you elaborate on some of those cases?
Yes. The case I wanted to present or talk about is a surgical case of colic, a horse that came in with a lot of pain, with normal blood values, but with a rectal suspect of a right dorsal displacement. The horse was put on a table. Right after surgery, it gassed up enormously, and we did a trocarization of the left flank. Then from day 2 on, it developed a post-operative ileus until day 6. Now, we did monitor, as we do with all surgical patients, we monitor the SAA, and that went up on day 2 up to 3,000. And white blood cells and temperature are quite normal.
Would you say that's an abnormal spike, an abnormally high spike?
Absolutely.
For a post-operative case?
Yes. Yeah. In most cases where we see it on other surgeries as well, it goes up to 200 on day 2, 200 to 400 maximum, and then it levels off on day 3 and goes down again. Yeah. This horse, it went up to 3,000 and stayed between 2,000 and 3,000 until day 5, and only then started to decline a little bit, with at the same time the ileus declining and resolving. Funny enough, the white blood cell counts over this whole period remained between 5,000 and 10,000, so nothing abnormal. Temperature was normal, so the only abnormal finding we did see in the blood was the SAA. Protein, etc., everything stayed normal.
So you feel like the SAA, that spike in SAA sort of, and the persistence of the elevation correlated very well with the supposed inflammation in the gut that was contributing to the ileus?
Yes, absolutely. Yeah. And it went down with it as well, so it was correlating very strongly.
Yeah.
We do monitor the SAA, and this is what it shows there. We do monitor the SAA because we don't use antibiotics pre and post surgically.
So you have a standard protocol that you've established in all of your post-operative cases to monitor the SAA?
Yes. Well, we did monitor it for a while on all of them, and because it was so consistent, we decided to look for the other symptoms. We don't monitor it constantly on every horse, but we do monitor it as soon as something is awkward. We will start monitoring the SAA. Yeah. And we know now what the normal curve is, and we have established our protocol how we can observe when something goes wrong, and then we know where to jump in right away.
Yeah. And what sort of cases do you typically monitor your SAAs?
Oh, on all surgeries.
All surgeries.
Arthroscopies, osteosynthesis, castrations, whatever we do, neurectomies, whatever.
And so if you observe an abnormal spike, something that's out of the range of the normal curve, in those cases, then that obviously suggests to you that there's something amiss with that case, and it might prompt antibiotic therapy, whereas you typically don't use antibiotics in Europe.
Yeah, then we will jump in with antibiotics and well, first of all, an examination and try to find out where the root is, and try to cut out the root.
Right. Well, that's excellent. That's great work. Thanks very much.
Thank you. Yeah.